All right, everyone. Thank you so much for joining us for today's webinar with Shiru. My name is Allison Catalano. And this presentation, of course, is going to be on prevention in the forthcoming Scottish election. So today we're going to hear from three speakers, starting with Professor Kat Smith from Shiru, who is going to be talking about some recent research that we've done on the Scottish Social Attitude Survey. We'll then hear from Dave Finch from the Health Foundation talking about their calls for the Scottish election. And then you'll hear from me and talking about what we've pulled out of the manifestos. At the end of the session, we'll have about 15 to 20 minutes for a question and answer session, which will be chaired by our colleague Fiona McHardy. So throughout the presentations, please feel free. There should be a Q&A function on your screen, and please feel free to use that and type in questions as they pop up, and we will get to that at the end of the talk. So thank you so much for joining, and with that, I will hand you over to Kat. Oh, Kat, we can't quite hear you, I think.
Sorry. Good morning, everyone. Is that okay? Is that working? Can you hear me and see the slides?
Yep, that's great. Thank you.
Okay. Thanks. Morning, everyone. I'm Kat Smith. I'm Professor of Public Health Policy at the University of Strathclyde and co-lead of Shiru, the Scottish Health Equity Research Unit. So I'm going to kick the webinar off by pulling out some key insights on public attitudes to health inequalities and social determinants of health in Scotland. So public understandings of health inequalities and relatedly some of the key socioeconomic determinants like housing and employment are a really important part of the evidence base for proposing policy responses to health inequalities, but they do remain relatively underexplored. So we designed 11 questions for the latest round of the Scottish Social Attitudes Survey. So that's a nationally representative survey that's undertaken every year by ScotSen. And since political manifestos are fundamentally about trying to secure popular votes, we thought we'd begin by setting out what we know about these public views on health inequalities and key issues that shape health inequalities. So these are the types of questions we put to the Scottish public. How important do people think it is to reduce health inequalities? What causes health inequalities? Should the government spend more on treatment or prevention? What's the most effective way of reducing deaths from alcohol, drugs and suicide? And how should the government, Scottish Government, improve housing and get people who haven't worked for a long time back into jobs? So we start with a really clear story, right? 94% of people in Scotland said that it was very or quite important for the Scottish Government to reduce health inequalities. And there were no notable differences on this question between demographic groups across the country. So given this, we'd expect to see strong political commitments to reducing health inequalities in Scotland. Next, what do people think about prevention? So ever since the Christie report, Scottish policy has emphasised the need for a preventative shift. Yet we know Scotland has struggled to realise this ambition, with services often still operating in crisis mode. The Scottish Social Attitude Survey show most people favour an even split between prevention and treatment. And so we asked about this in relation to health and homelessness. Where people do make a choice, they tend to prefer prevention over treatment. Since at the moment, Scotland's currently spending far more responding to and treating issues as they arise, it suggests that people would like to see some significant shifts towards prevention. But there is an important caveat here. So support for prevention is stronger in less deprived groups and in people living in rural areas. Those living in more deprived areas, especially more deprived urban areas, tend to, they were more likely to favour an equal balance or lean towards treatment. And this likely reflects people's lived experiences. So if communities are already experiencing crises, they're more cautious about shifting resources away from support and treatment towards prevention. So in terms of what we might expect to see reflected in the manifestos, we'd expect to see strong commitments to prevention, but combining this with visible support for the current needs, especially for more disadvantaged communities. So we know people want to reduce health inequalities, but what do they think causes health inequalities? And this is quite a busy graph, and that reflects the fact that there are really mixed views about causes. It spans diet, smoking, drinking, healthcare, stress, work and housing. It's also important to note that while many people in Scotland did cite diet, smoking and alcohol as important contributors to health inequalities, so you can see they're the most popular responses, that doesn't tell us why people think these differences exist. So why they think poorer people are less likely to eat well or more likely to smoke and drink. And it doesn't tell us what they think the policy responses should be. For example, it's possible that some respondents, the less likely to eat well option reflects awareness of food poverty in Scotland, whilst others might think it's more about lifestyle choices. There's also some important subgroup variation in this question. So more deprived groups tended to emphasise smoking, alcohol and stress, while less deprived groups were more likely to cite diet. And when it comes to minority ethnic communities and urban groups, they were more likely to cite housing and healthcare access as issues. Very few people in Scotland think health inequalities are mainly down to genetics or variations in exercise. So those were some of the least popular options. All this suggests people in Scotland are not expecting easy, singular solutions to health inequalities. And if political manifestos reflected this, they would commit to taking multi-pronged approaches to reducing health inequalities, including policies to improve people's access to healthy food, regulate harmful products and industries such as tobacco and alcohol, alongside efforts to improve healthcare services and provide good quality jobs and housing. Scotland, as we know, has the highest drug-related death in Western Europe and elevated alcohol and suicide mortality, with harms heavily concentrated among men, particularly men in the Middle Ages and young adult men. The Scottish Social Attitudes Survey shows the public sees poverty reduction as the most important way to reduce drug and alcohol deaths, with mental health services second. For suicide, mental health investment is a clear priority, but reducing poverty is the second most important popular choice. So here we see a very clear public understanding of the upstream socioeconomic causes of some of Scotland's worst health outcomes. And the findings also show there's very limited public appetite for punitive approaches to drugs and alcohol in Scotland. So only 1% opted for tougher laws, sentencing and enforcement kind of focus, or controlling, restricting benefits as an option. There are growing concerns across the UK about people who are out of work, especially out of work longer term, and perhaps not looking for a job due to ill health, disability, or caring roles. Since employment is an important social determinant of health, we decided that we'd use the Scottish Social Attitudes Survey to ask people how they think this issue should be tackled. And the results show people in Scotland are fairly evenly split between policies supporting effective individuals and policies supporting employers to do more to provide jobs that suit people who've got a health issue or disability. And there's also a lot of support for affordable childcare. So once again, we see public opinion favouring a multi-pronged approach, combining support for people, employers, and enabling services like childcare. Housing is also a key driver of health in Scotland, and in the context of Scotland's declared housing emergency, it's playing an increasingly important role in health inequalities. So in the Scottish Social Attitudes Survey, we asked people what they felt the main causes of the current housing shortage are. And here we see people in Scotland are fairly split. Though house builders not building enough houses at prices people can afford was the most popular reason, with too little government spending on social housing a close second. It's also worth noting that although too many people coming to live in Scotland was the third most popular reason, only 1% of people said that the issue was too many houses given to migrants or benefit claimants. And likewise, very few people said that a key issue was the result of buy-to-let kind of boom. It was a similarly mixed picture when we asked people what would be the most effective way of reducing the number of homes that are unhealthy for people to live in. But as with health inequalities and employment, there's little sense of silver bullets. Rather, people in Scotland are fairly evenly split on what effective policy responses look like, with support for investing more in social housing, enforcing quality standards, regulating landlords, and financial support. All this suggests we might expect manifestos to say quite a bit about housing and to focus on social housing, quality standards, regulating landlords, and addressing affordability. So that was a very quick run through some of the headline findings from Sherry's questions in the latest Scottish Social Attitude Survey. If you'd like to dig into more of the detail and analysis, you can find the full report on our web pages, along with all of our other Sherry outputs. I'm now going to pass to Dave Finch, who'll be outlining what the Health Foundation are calling for in these Scottish elections.
Thank you, Kat. I'm just loading my slides up. Hopefully they're now there to be visible to everybody. That's great. And thank you for inviting me to speak today. I was going to, as Kat said, kind of outline the sort of things we'd like to be seeing as priorities for a new government, with a focus on improving health and reducing inequalities. I thought I'd start off by saying that this is very much through the lens the Health Foundation take through thinking about the best ways to improve health and reduce inequalities, and through taking a preventative approach on what we call the building blocks of health, as kind of hopefully displayed by this chart, where these are all the kind of different factors throughout our lives that help to shape our health. Things like having good work, the types of food we eat, having good quality housing, having sufficient incomes. And these are all kind of key things that we need to be in place to help support good health in the first place, rather than sort of taking an approach of waiting until our health deteriorates and we need to take more acute action. So it's really through that lens, and our recommendations are informed also by the work that the team at Sheru have been doing over the last couple of years, and also through our kind of advisory group and stakeholder kind of conversations as well, to make sure that we're effectively routing this type of direction in this situation in Scotland. So just to, I suppose, move into the first element, is really thinking about risk factors. And so kind of alcohol, tobacco and unhealthy food are three of the leading risk factors for ill health. And I think it's important to say that Scotland's got quite a history of success in this area, bringing in things like minimum unit pricing. And often these are things that are effectively you can put into place to help improve choices available to people, although they can often be kind of depicted as something slightly different. I think on the type of action in this space, it's really keeping building on things that have already happened. Wanting to see kind of further restrictions on marketing for alcohol and unhealthy food, giving kind of greater powers to local authorities and health boards to have a greater say in the types of sort of food and alcohol outlets that are available in local areas, and where they can be where those can be placed. More expansion on smoke-free public places as well, and also being really clear on the role that food and drink corporations can play in developing policy making, to make sure that they're not having a kind of disproportionate influence on the policy decisions that are ultimately made. And these are all really about trying to make sure we're shaping environments, making sure people don't have constrained choices, but actually have more options available to them in the types of sort of goods and services that they're able to access and consume. In another area, thinking about employment and healthier working lives, where employment is a really key determinant of health, both in the types of the structure it can bring to people's lives, the ability, the opportunities for socializing, but also the income that employment can bring. And here, I think we have kind of three main concerns. One is that we've seen this worsening of health in the working age population, particularly within sort of mental health conditions. Scotland historically has higher rates of economic inactivity due to ill health than in the rest of the UK. So this is a kind of long-term sort of structural issue to be addressed. And we're also seeing, I think important to recognise, is that we're also seeing increasing numbers of people who are in employment with work-limiting health conditions, which starts to slightly change the policy challenge, in that it's about helping to keep people in employment with health conditions as much as it is about helping people to come back into work if they've had a health condition that's prevented them from being in employment. And here we're really focusing on the types of system and structure you can put into place that helps to keep someone, as their health starts to affect their ability to work, helps to keep them in employment, or if they need to spend time recovering from their health condition, to get them back into work quite quickly, so they're not left to kind of fall out of the labour market. And the types of things we'd like to see here is more sort of caseworker-led support to help people as their health starts to affect their ability to work, to make sure they're quickly and proactively supported to help move back into employment. Things like the ability for helping people who can't continue in their current role to move into a new role. Things like job pooling initiatives, wanting to do more to make sure that employers are really putting in place that best practice, so that people are helped as soon as possible in the workplace if their health affects their ability to work. And also, I think a really key ask is really using the kind of the role the Scottish Government can play in setting standards and quality in the way that it has through the real living wage, is actually to reinforce kind of best practice around paying high rates of sick pay. And that's not just within the immediate kind of public sector workforce, but also contractors and around, because the statutory rate of sick pay is so low. So it's really trying to help set those higher standards where you pay closer to a kind of 60 to 80% replacement rate on people's pay if they're out of work due to ill health, which can help just make sure that they don't have a shock to income that leaves them actually in a position where their lower pay is actually making their health worse. Moving to housing, which is, I think, a really key building block of health. So I think it's very well known about the housing emergency in Scotland. And I think, you know, two areas that we're particularly concerned about are the rise in children in temporary accommodation, which is both a reflection of housing affordability, but also means people living often in kind of unsuitable, poor quality accommodation, which can also affect health, and also sort of tackling the quality of existing housing stock as well, and including kind of damp and mold and things like overcrowding. And there are elements of this in the new sort of Housing Act, but it's really sort of taking action on those to make sure we see some of those changes coming through. And I think probably not surprisingly, we're asking for, you know, commitment to delivering on the social housing that is needed. Really a focus on preventing homelessness, so stopping people falling, sort of being evicted in the first place or being forced out of their homes, partly due to affordability issues. And then also looking to address those kind of high costs of temporary accommodation, which are putting pressure on other public services. Or at least those costs mean that there are puts pressure on councils, the ability for them to spend on other services. And also that focus on kind of continually trying to improve housing quality to help protect people's health so that they're not living in those kind of damp and mouldy conditions. A sort of further and the final aspect I was really going to focus on is child poverty. Again, you know, there's obviously lots of often a key topic of debate and where there's lots of policy, and we've still got over a fifth of children in Scotland and some way to go to try and meet sort of statutory targets on relative poverty. I think the things to think about here are obviously the high share of children in poverty living in a household where someone's already in work. So you can't just focus on supporting people into employment to solve poverty. And, you know, also recognising that we're already seeing some difference in poverty from policies like the Scottish Child Payment, and you know, especially if you contrast kind of recent poverty trends based on work from sort of colleagues on the call at Sherrow and the Fraser Under Institute. I think here the action we'd like to see, I mean, I think inevitably to improve or reduce child poverty rates, there's a need to focus on kind of further income transfers, so things like increasing the Scottish Child Payment quite sort of mechanically almost. If you want to reduce poverty rates, you need to sort of invest more in boosting incomes. But I think what's really necessary if we're worried about health inequalities is really think about mitigating the health impacts of poverty. So these things like ensuring people can have enough, can afford to eat healthy food, you know, can afford to maintain some basic things like accessing good quality housing as well, and also trying to focus on people who are actually not just below the kind of relative poverty line, but in deeper poverty, which is likely to be where we're going to have some more kind of more directly health harming impacts. It's very much about targeting that support at the most disadvantaged if we're worried about their kind of health prospects over purely sort of seeing changes in poverty numbers below the poverty threshold, but then also a focus on addressing some of those drivers of poverty as well, where I think, you know, clearly there are big parallels between the types of approach needs to reduce poverty and also to help improve people's health and reduce inequality. So there are things like helping to further boost parental employment, but also kind of pay and progression opportunities for parents, and including making sure childcare is affordable. And also more longer term as well is really trying to make sure that attainment gaps are closed, and we're boosting education as well, so that long term people have the kind of education that means they can more readily find employment, but also progress and have kind of higher quality jobs as well. So it's very much a mix of kind of more immediate mitigation, but also a focus on some of those longer term outcomes. One, I suppose, almost a prime example of the type of approach that we would want to see, and kind of why it's so important to have that preventative approach, is thinking about younger men at risk of death from drugs, alcohol, and suicide. Kat's already talked about the very kind of high rates of drug-related deaths in Scotland, and and these are very much concentrated in the most deprived areas. I think again, this is building on work from the Sherry team. Is if you can look on average, often men seem to be doing quite well with kind of higher earnings and low rates of poverty, but it really sort of masks this subset of people who are often missed and living in poorer socioeconomic conditions, and too often, partly in the way that sort of the policy system is focused and in the types of metrics we often look at, this group tend to be invisible almost until they reach crisis point, when they start to access services. And so there's this kind of really clear gap in catching people before their circumstances have gone in the wrong direction, or too far in the wrong direction, and they're entering into kind of acute need. So here, and I suppose it's an instance where perhaps there is plenty of manifestos around these areas, but I think slightly less in this more upstream approach is really trying to get better join up action across government at different levels through better governance and accountability, aligning budgets so that can really focus on preventing. It's not just preventing on deaths from drugs, alcohol, and suicide, but really stopping people from getting to a point at which they're at risk in the first place. And another key part of that is really helping to improve data learning and coordination across sort of national and local government. I suppose a key reflection here, just as I wrap up, is probably not expecting to see lots of manifestos about that kind of more coordination across government. They're not necessarily hitting the kind of those big types of retail offers that you'll see in a manifesto. But I think what it really underlines is this need to really post-election, you need a big shift from developing strategies and these kind of and the bigger sounding policies into implementing and delivery. We think there are kind of opportunities already around this from the kind of current government, where these may obviously change depending on what happens at the end of the election, but things like reform of the National Performance Framework, the recent Population Health Framework, and sort of efforts to start measuring prevention spend are really opportunities to embed that kind of preventative approach. But what will really make a difference is that shift into action and having those kind of clear delivery plans, monitoring progress and taking kind of shared accountability for achieving those goals, which I think we can hope to, probably won't hear too much about that in the election, but can really hope to see that being a prominent part of post-election. So thank you, and I will pass on to Allison.
Thank you so much, Dave. That was really very interesting to see what we're hoping for from the elections. I think a lot of it will kind of be reflected in what we actually saw in the manifestos, but there's definitely a lot of stuff that's not. So I'll go ahead and press the correct button. There we go. So the first thing I'm going to do in the chat, I'm going to go ahead and put in just some information about the Health Foundation's briefing, as well as a link to sign up for our mailing list at Cheru in case you want to stay on top of some of our election analysis. We will have a blog coming out in the next, 2 weeks, hopefully a little bit before the election, but possibly like right up to the day. So sign up for our mailing list if you want to see more about that. We've also done a lot of work in the Fraser of Allender Institute, where I'm a fellow. doing a lot of kind of the fiscal and tax analysis. So my presentation will talk a little bit about that, but if you want more information, there's a link to that as well. So first of all, what do we mean by prevention and why are we interested in it? I think probably this audience has a good sense of that, and given what Kat and Dave have just talked about, you have a good sense of that as well. But for us, we're specifically looking at primary prevention. So we're looking at the policies that seek to improve the social, economic, and environmental factors in which we live our lives, thus preventing poor health outcomes before they can occur. It's also really crucial to the budget long term, right? We talked about the National Performance Framework and the Population Health Framework. But it's been a topic of discussion in policy as far back as 2011, if not earlier. And so because of this and because of the things we pulled out of the social attitude surveys, well, we'd expect to see this dimension of prevention explored in the manifestos. Of course, there's tons and tons of things we can go into. There's a lot of stuff that they say about drug and alcohol deaths, about childhood poverty specifically, about, well, significantly less that they said about young adult men and deaths of despair, which Dave was touching on earlier. But we did go through and we analyzed all of that. For the sake of this presentation, we're just going to kind of keep to these sort of top four, which is going to be prevention in healthcare, primary prevention in health, housing and homelessness, employment and health, and poverty and the cost of living. Just kind of give a high-level assessment of which policies fall under primary prevention and how feasible they are. In kind of going through the slides, I've, pulled up a recent election projection, and I'm going to keep things sort of in this order. There is, different polls have been coming out with different things, but we are seeing kind of a similar trend where S&P is probably going to take a majority of seats, possibly. Reform and Labor have been kind of moving up and down, and then the other three parties have been kind of switching orders based on which poll you're seeing. So we don't really know the outcome, but that's kind of the order in which we're going to keep it. So kind of a very high-level assessment of the content and quality of the preventative offering from the 6 parties predicted to win seats in May. All of the parties did have some form of preventative messaging, which I think was a surprise to a lot of people when I was telling them that. With S&P as the incumbent party, a lot of their policies currently are trying to become more preventative. And a lot of the things that they've promised in the manifestos really reflect a continuation of the current government. So in a lot of ways, we can kind of extend any thoughts or criticism towards the government's current approach to this manifesto. As far as Reform and Conservative goes, a lot of their content was really similar, as we might expect. There were a lot of things that weren't preventative or that would work against prevention, which we'll go into a little bit later. But some of the things we saw were things like pulling back on housing building regulations, things that would, if done poorly, could make buildings less safe, things of that sort. The other 3 parties we saw had very long manifestos, which kind of read like shopping lists, tons and tons of detail, but it's really hard to kind of determine, where are our priorities, where's funding, where's the feasibility. One of the things that we've been kind of calling for the Scottish Government is also that we see more of a joined-up approach between different departments. So just kind of as text documents, what we saw in a lot of these is that they're still having a very siloed approach to each of these different topics. The health offering in the health section was very much only on health without much of an acknowledgement of how much other things play into health. And same with every other section that we saw. I will say, the Liberal Democrats did a really good job of kind of circling back to other areas that are also quite relevant, and, mentioning that part of their health plan involves employment, involves social inclusivity and things like that. Like I said, every party had some mention of the word prevention. In some cases, it was really directly in the health sections. In some cases, it was falling into homelessness or criminal justice policy areas. And some of these were more evident throughout than others and more effective than others, potentially. So let's kind of get into it. So the goal here was to understand how much the parties acknowledge and discuss primary prevention when discussing their policy goals for health. What we found was that in chapters on health, again, really the only party that engaged with primary prevention extensively were the Liberal Democrats, who covered topics like employment, disability, social inclusion. These policies often didn't come with details on how they'd be costed or delivered. Health was also a really major focus of SNP, Labour, and Green Party manifestos, but a lot of the discussion in the health chapters themselves fell under secondary or tertiary prevention. Green Party actually acknowledged this up front, saying something like they want to tackle Scotland's poor public health by investing in prevention and early intervention. But also that I have the quote on my screen, they recognize the importance of protecting funding to secondary and acute care. So that's fairly reasonable. For Labour, we kind of felt like it was almost a missed opportunity. You know, they talk a lot about helping people live well, which largely covers access to health services. They also talk about promoting healthy lifestyles, which we'll talk about in a bit, which is an important thing to touch on. And both of these are very valid in the preventative space, but they don't really address inequalities in the way that we'd expect. With reform, we found some misleading figures on health expenditure and growth, and they did mention that they would like to prioritize a shift to preventative strategies and persistent inequalities, but they don't really provide very much detail there. And finally, you know, for the Conservative Party, prevention was really mentioned with regards to homelessness, not as much in health. In general, they talked a lot about improvements to the NHS, which they kind of planned through reducing like management and administrative costs, which was similar to reform proposals. This is a pretty valid thing to want to do, but what we found is that there's nothing really to indicate that efficiencies would free up the millions, if not billions, of pounds that would be needed to implement the programs that they've discussed. So looking to prevention and health harming products, alcohol, tobacco, vaping, drugs, and unhealthy food. Like Kat was saying in her discussion on the social attitude survey, this is something that people really care about. This is the main reason people think that this is the main thing that people think of when they think of health inequalities. This is what we think is happening. But this is one of the clearest things here that we can see is the divide in approaches. So at one end, you have the Greens, who have taken a very comprehensive public health view, strong regulation of products and marketing, harm reduction, willingness to tackle industry directly. The Liberal Democrats, not quite as far-reaching, but still a lot of discussion on prevention and harm reduction, particularly when it comes to drugs. More towards the middle, we saw Labour and SNP framing these issues as public health challenges, but with policies that kind of focus on services, treatment, and targeted intervention rather than like large-scale regulation. Labour is a bit more explicit about the scale of the problem, especially deaths from these causes, while SNP kind of focuses more on managing harms and pressures of the NHS. Towards the other end of the spectrum, we saw the Conservatives kind of largely rejecting a regulatory approach altogether, particularly with alcohol. Instead, we found them kind of emphasizing treatment, recovery, and personal responsibility while supporting alcohol industries. Reforms, like we said, you know, reform was the kind of the shortest manifesto overall. So one of the things that really stands out there is sort of what's missing. You know, very little detail on the issues, no position on regulation, prevention, or harm reduction. We really found surprisingly little detailed discussion of policy responses to alcohol beyond minimum unit pricing, in spite of the issues that Scotland has with alcohol deaths. And really only the Scottish Greens had much to say on regulating industries that profit from these products. So moving into housing and homelessness, just to set up some context, Scotland's largely declared a housing emergency, and homelessness applications over the past 2 years are higher than they've been at any point previously. And the manifestos all dealt with this different ways. And the way that we kind of looked at it is how they discuss availability, affordability, and quality, all of which have health implications. Availability and affordability have a lot to do with household incomes. It has to do with stress. It has to do with how much we have to spend on other things. Quality can have very direct effects on our health through things like mold, damp, heating, and overall safety. In general, we found that conversations really focused on availability and affordability. Sometimes these were vague. On the whole, quality was the most overlooked. One thing that we know is that private rented housing in Scotland is the most likely to be poor quality. There isn't very much legislature to protect private renters in this regard, and it wasn't addressed by any of the parties. More often, the parties, Labour in particular, discussed addressing this through social renters, but we didn't see much otherwise. Homelessness discussions really fed into discussions on availability and poverty, which we'll explore in a bit here, but often lacked detail. So everyone's really listed housing targets. As I've said, housing quality overall was really vague. We found, reform and conservatives kind of focused the quality discussion on what we'd call in the US curb appeal, essentially making sure that locals have more of a say in community design, which kind of expands upon local place plans, which is a policy that's already in place. Like I said, Labour discussed AWAB's law, which is a law that comes into play in Scotland in October that requires social landlords to act on housing disrepair within a certain amount of time, so it's already in progress. Homelessness was also quite vague. It's not totally clear what SNP's Homeless Prevention Fund would buy, looking at it on a per applicant basis, which may not be totally valid and that's fair. It's just not clear what we can do to prevent the volume of applications using that fund. And again, we saw a lot of stuff on this kind of laundry list of thoughts and policies, so that makes it a bit unclear what parties like Labour or Green Party or the Lib Dems might prioritize. Moving to employment and health, we found surprisingly little policy discussing people who are out of work due to ill health. Which really kind of surprised me because we know that this makes up a really significant proportion of Scotland's out-of-work population. And it's been identified by the Scottish and the UK governments as the most important demographic to address if we want to increase employment volume on the whole. So surprising that we saw such little consideration. We did see some discussion on supporting people with health conditions. We did see some talk about supported employment, rather, which is essentially a range of adjustments which make work more accessible for disabled people. We saw that from the Green Party and the Liberal Democrats, but both kind of lacked certain necessary details. The Greens just kind of mentioned making funding more sustainable. Doesn't really go into more detail on that. The Lib Dems kind of allowed, they proposed a policy which would allow disabled people to take modifications with them if they move jobs, which is interesting, but still kind of hard to know how that would work in practice. We did see a good discussion on work quality and fair work policy, which touched on how jobs impact health. I think Labour had a very interesting one about protecting workers from assault and establishing a council for employment injuries. But largely the discussions on employment were what we would call like demand side. So creating environments through tax policies, apprenticeships policies, or skills policies that would allow businesses to hire more workers. And then our last policy area for today, we looked very broadly at poverty, welfare, childcare, and the cost of living. So there's a lot to cover in a few slides, but these policies actually play into each other really closely, and in the manifestos themselves are often thematically connected. And we found that they had a range of different ideas in terms of welfare and cost of living, but we're a little bit more consistent in their messaging on poverty and childcare. Most parties discussed expanding the current funded childcare option, and as far as reducing poverty, a lot of them just talked about it through the lens of growing the economy. Because these are so dense, I've kind of broken it up into two slides. So for SMP, we found that the discussion on welfare and poverty largely centers on policies already in place. They've also talked about various other policies like expanding free school meals and addressing the cost of living. One thing that they found with the SAI's research is that the mention of the word poverty doesn't, that these promises would be really expensive, and it's largely not acknowledged. As far as reform goes, we didn't see any mention of the word poverty, and we also didn't see any discussion of childcare. They do talk about some changes to welfare, like face-to-face assessments for Social Security, but they don't really talk about how they would decrease welfare spending. There's one proposal that is worth kind of flagging, which is that they talked about tapering the care support payments, so there's not a cliff edge at a certain income threshold, which would probably be well received, but in contrast to the rest of their messaging, that would cost more money than it currently does. And Labour, again, had a very, like I said, long manifesto, and they had a lot of things, especially around early childhood related policies, that I've kind of listed in this fourth bullet point here. For other three parties, everyone had proposals to increase the free childhood offering, with the Greens being the most generous. One interesting thing that we noted in the FAI's work is that they've included a cash transfer incentive, which might mean that parents who need the money the most don't send their children to childcare because they need the money more. And there's a question about whether or not this would widen certain inequalities because these children whose parents need the money the most aren't accessing an early form of education and socialization. The Lib Dems have a bit more of a modest but potentially financially sound policy, which just moves up the funded childcare by a couple of months. And the Conservatives are looking to expand free childcare to working parents, which is what they do in England, I believe. But that, of course, kind of creates a catch-22, wherein there'll necessarily be parents who can't work because they can't afford childcare. They can't get childcare because they can't get a job. Right. So there's been a lot of information. So I'd really like to thank you guys for going through it with me. Like I said, I've tagged the links to Dave's report, our newsletter, and the analysis from the FAI in the little Q&A box. But just to flag, a recording of this webinar will be going up, made available on the SHRU website in the next couple of days. And we'll have some pre-election analysis coming out in the next couple of weeks, as well as some post-election analysis coming out after we've seen the program for government, probably towards the end of the summer. So do keep an eye out on our website for that. And yeah, I'll go ahead and stop sharing my screen, and we can move on to the Q&A section. So Fiona McHardy, my colleague, is going to be sort of chairing that. And I haven't been looking at the Q&A, but hopefully we've had some questions coming in.
Good morning, everyone. So just to kick us off, there was a couple of clarifying questions that came in across. So we were asked about the sample size for the social attitude survey, how many people did our work come into contact with, and also a kind of broader question of did we do any analysis by voter or party affiliation and what they thought around health inequalities. So Kat, if you could kick us off there.
Yeah, so all the full details about the sample size and the details of the methodology are in the report that we put a link to. I think they had like 12,565 in the main sample, and then from that, I'm just trying to find the details of. So were you asking from was it the question about the pool, the sample pool, or the final numbers included?
Just I guess a general question about just sample size in terms of what that survey told us.
Yeah, I can.
Yeah, sorry, Alison. I'm just.
Yeah, no bother. So as far as the voter stuff, we didn't look at anything by voter affiliation. The population that responded to the survey was 1,494. And then we broke it down by various demographics, the smallest group of which were people who were from an ethnic minority, and that was about 91 respondents there. And that was the smallest group that we could break it down to. Anything we published did have, what we would call a robust sample size, so sample size over, I think, like 10 to 12. We tried to keep it to, like, aggregate up as much as possible where we needed to.
Okay, great, thank you. Got a question here from Sarah, who's asking about the actions required to address the increased risk of despair, particularly what we're seeing in younger men and deprived areas. And I guess the question's around what actions need to address the underlying gender-related causes of this. We know that men are less likely to seek help for issues, and how do we seek to change that? So I'm not sure who in the panel wants to pick that up.
I'm happy to pick that up.
Thank you.
Worse. Yeah, so I mean, quite a lot of the things that we'd like to see in relation to death despair are about getting upstream and tackling those fundamental issues like poverty and work and so on. We also know that, so Fiona and I within Sheru in particular are doing a lot of work with frontline services in some local areas around this issue. So we've heard a lot from practitioners on this, and it's really interesting because they are saying that like single adult men are one of the key groups accessing crisis services, so homelessness services and some of the employability services. So in that case, it's not so much that they're not accessing those services, they are accessing those services, but a lot of those services are under extreme pressure, and single adult men or single adults indeed are not a prioritised population group at the moment, so they're often struggling to justify giving the support that is required. So that's something. There are also some gender-related issues around masculinity and so on, but I think the core thing that we're picking up is that services are under extreme pressure, and it's very hard to prioritise this population group. And that's something Fiona and I will be digging into in other Sheru work, where we'll talk a lot about what practitioners say and what they think the responses are, and we're also doing some peer community-based research where people who are in this population group are doing research in their communities and telling us what their perspectives are, and that'll be coming out over summer.
Okay, thank you. More questions coming in here. So in terms of, regardless of which party is in power, in terms of progression on health inequalities and the importance of working across government and of course the local level, what should we be looking for in terms of tracking and monitoring and understanding the alignment across health inequalities in Scotland?
Dave, do you want to go first on that, and then I can chip in? What do you think?
Yeah, sure. No, that's great. Yeah, I think, I suppose there's a couple of elements to it. I mean, one thing is, I suppose you have to recognise, you're not going to expect to see huge shifts in something like life expectancy or healthy life expectancy within, well, possibly within a parliament, although it's slightly depressing to say it. And I think, so what you really need to be focusing on is, you do need those kind of headline metrics. I think you need to understand how those then, the distribution of those as well across different population groups. But it's to think about tracking progress on, as what we would call the building blocks of health as well, so that you can see that longer term, if you're seeing improvements in those things are really important influences on health or drive inequalities, you would have some at least hope and optimism that in the future as well you'd start to see those kind of health outcomes change. So that's things like closer tracking of things like, well, those are already quite close tracking, but tracking things like child poverty, looking at the housing situation, employment outcomes. And I suppose if we're relating it back to some of those groups we know are most at risk, it's actually getting underneath the averages as well to check that you're not seeing groups who are kind of falling out or being left behind. But I think it's also important, it's not just the outcomes. I think the thing that tends to come back time and again whenever we look at kind of progress in addressing health or improving health and inequalities is kind of that lack of actual progress on the implementation side or effective implementation and delivery. So I think it's not just about tracking the outcomes. I think it's really about tracking progress on delivery and having some of those really clear milestones in place so that you can drive the actual action rather than just having big high-level commitments and policies and then tracking those kind of final outcomes, which I suppose is what is kind of the approach in some of the child poverty metrics. But Kat, did you want to add to that?
Yeah, so that aligns very much with what I was going to say, so I won't repeat that, but just to add, I think the other thing that you would expect to see changing is people who are providing those frontline experiences in local areas, and people in communities, especially in the most deprived and marginalised groups who are at the brunt end of inequalities. We'd expect to see them saying that they're feeling that things are getting a bit better. So that kind of more qualitative input, so lived experience from communities, but also frontline practitioners feeling that things are getting better, is also an important sense that we're on the right track. And yeah, we definitely don't feel like we've got that at the moment.
Okay, thank you. And Alison, is there anything you wish to come in on here? Or?
No, I think we've covered it well.
Thank you. Okay, a couple of questions, I guess, around framing and how we think about prevention. So, question from Katherine here. Did you get the impression that prevention was primarily framed as a system efficiency or population health issue, rather explicitly as an inequality issue? So, thinking about, does the framing matter in terms of how we shape what's funded, thinking about political accountability and so on around that?
Answer that. I textually, like reading the manifestos, I think everyone kind of did this a bit differently. I think you'll see a lot of the parties some of the parties would have framed it more as a system efficiencies issue. Some of the parties, like the Greens, very much framed it as a explicit, like an inequality population health issue. I think mostly we found it sort of in between. And as far as whether or not this framing matters, it feels a bit indicative of what we can expect from the government itself, right? You see the SNP kind of acknowledging it, maybe focusing a little bit more on the system stuff, acknowledging prevention. We know that they're working on prevention, that they're trying to implement preventative policies. There are still some gaps in some areas in which this could be a bit stronger, in which we could do it better. And I think that reflected the way that the manifesto was constructed and the things that we got out of that manifesto, if that makes sense. I don't know, Dave or Kat, if you have anything else to say on kind of that.
I mean, I think I suppose it's often what you do tend to see is particularly if you're talking about kind of health and prevention, it tends to be very directly about kind of trying to relieve direct pressure on the NHS, and it becomes that more sort of those more downstream measures often, which I suppose it's kind of reflecting on what does it mean in a sense of, is it a problem if they're not going quite broader? I mean, it'd be good if you did see that really cohesive, full preventative vision coming across the in the manifestos. But I think actually there's a longer term thing where the more it's increasingly recognised, and you can see it coming through in things like housing, where it's being acknowledged on the sort of temporary accommodation side in places, and it's kind of, I suppose, the more that you can see that coming across in different areas, I think the more you start to move towards a kind of, I suppose, a policy approach in which you're actually more explicitly recognising prevention and trying to do things and put those more upstream measures in place. But you do, I suppose, the nature of the manifestos will often be they're addressing quite a very live, visible, acute issue, and that's the thing they're going to be speaking to, the kind of headline figure, unless that kind of the actual long-term approach you need to resolve the problem. I guess the hope is that the actual policies that get implemented address the longer-term issues and aren't just kind of sticking plaster type activity.
And we're just into our final 2 minutes of this webinar, so I guess maybe one catch-all question. What would support us to make the biggest difference in the next 5 years in tackling health inequalities?
Do you want to go first, Dave?
Yeah, sure. Yeah, gives me the less chance of you saying it. I think the main thing for us is, it is that obviously you need action across a lot of areas, but it's that real focus on delivery and implementation, I think, will make the big difference. So you could have the perfect vision represented, but if there's no progress on it, that'll be a real problem. So I think for us, it's that real switch into delivery after the kind of rhetoric of the election.
Yeah, I'd really agree with that. And I often think this question can be a bit of a, can push us into giving an answer that's not realistic, because I think we know that health inequalities won't be addressed by a single policy. It's going to be addressed by a range of policies that tackle the circumstances in which we're all living and working. But it's only going to make a difference if those policies are designed in ways that are implementable and have the resources that they require to make the difference that they need. So yeah, if we were going to look at one thing, I think it is just what Dave said, that kind of is that vision being translated into actual action that's making a difference.
And Alison, do you have anything to add on from an economist's point of view?
I mean, I would agree with all that. I think that there were definitely some questions about, the fiscal feasibility of a lot of the offerings that were put up. There were also a lot of things that were maybe small and not very glamorous that are totally feasible and that we know would make a big difference in a lot of policy implementation spaces. Things like there were a few calls for longer term funding for third sector organizations who do deliver a lot of the preventative policies. Seeing, things like that, I think definitely pushes the needle in the right direction.
Well, that is us out of time this morning, so thank everyone for coming along today, and encourage you all to go onto our Cheru website and have a look at our publications, particularly the latest ones that we've referred to in this session. Thank you very much.